Okay, so today I'm going to talk to you for a minute about anterior pelvic tilts and how they could affect your body in a negative way and cause issues like lower lumbar instability. So imagine you're looking at somebody from the side and this is their pelvis. So when a patient has an anterior pelvic tilt, the front of their pelvis, which is this side, is lower than the back of the pelvis, which is this side. So down here you have your quadricep muscles in your legs, and over here you have the hamstrings, right? And then up here you have your abdominal muscles. So the abdominal muscles are weak and they can't pull this part of the pelvis back up. So if a patient had a C-section, they're going to have weak abdominal muscles that may not be treatable by just doing core work. So they may need work on that scar tissue. But there are also issues with a shortening of the quadriceps and a lengthening of the hamstrings, and those muscles are all hypertonic. So you're going to need some body work on those muscles. You can definitely benefit from acupuncture to help to relax those muscles. Now let's talk about the curvature of the spine when the pelvis is in this position. So normally you have a slight lordotic curve of the lumbar spine. What happens when the pelvis is up here is it accentuates the lordotic curvature of the lumbar spine, and there could be a anterior stacking of the vertebrae where the vertebrae are now like a little staircase. And what is happening is the peripheral nerves that run along the spine are now getting compromised by this abnormal curvature. And those nerves innervate your reproductive organs and they innervate your organs of elimination. So you may have issues with menstruation, you may have issues with bowel movements, you may have issues with urinary incontinence, things like that. The lower diaphragmatic branch of the vagus nerve, it innervates the sacral area of the spine. The nerve actually goes into the S4 sacral foramen and innervates those particular organs, the uterus in women and the genitals in women and men, and also the bladder and the organs of elimination. So it's really important to treat this issue before it becomes really bad. I usually use E-stem around that pelvic region in order to stimulate the muscles into contraction and then relaxation. So I use a contract relax technique where we get a muscle twitch reaction in the quadratus lumborum muscles and the multifidus muscles, which are the muscles that really hug the spine in that lower lumbar area, because if there is neurological issues there that innervate those particular muscles, they may be stuck in contraction and that patient may have a lot of lower back pain. So it's very important to get these issues treated before they become much worse, because the more the spine becomes hyperlordotic, the worse the nervous system is going to react in that particular area of the spine. So if you have any particular questions about this, if you have an anterior pelvic tilt, definitely get treated with acupuncture and E-stem and body work, massage work, soft tissue work, cupping, stretching, all of those modalities to help get your pelvis back into the proper position. Another aspect of this particular issue is if a patient is sympathetic dominant. If their nervous system is in a sympathetic state the majority of the time, the pelvis will tilt like this because that is the natural response of the pelvis to go into an anterior tilt when the body is in fight or flight. The body has an anterior pelvic tilt when you are running. So that is the flight portion of the fight or flight response. So if you're sympathetic dominant, you're going to have an anterior pelvic tilt. So we also have to work on your parasympathetic nervous system to help you to relax. This is a stress response. There's also issues with the psoas muscle being in contraction because the psoas muscle is one of the primary responders to stress. The psoas and the SEMs, the muscles here and here, and the muscles deep in the lower abdomen. So when I do E-stem on those particular areas of the lower lumbar, I notice that a lot of people have psoas releases where they can feel the psoas muscle pulsating and then relaxing because of the deep electrical stimulation in that area. I also like to needle around T11 and T12 where the psoas attaches to the anterior portion of the spine. So I'm kind of needling behind that area to give it a little stimulation as well. So once again, if you have any questions about this particular structural issue, if you're having a structural issue in your lower lumbar, if you have lower lumbar instability because of an abnormal curvature of the lower lumbar spine, there may be a flattening of a lumbar vertebrae, there may be compression of a disc in that area, you may have a herniated disc in that area. All of these could cause issues with your autonomic nervous system and the peripheral nerves that are running along the spine. So definitely reach out to me, and I will do whatever I can to help correct this problem. If you can't make it in to get treated, definitely start working on some core strengthening exercises, planks, crunches, sit-ups, all of the different exercises to strengthen your core. I know they have the machine at the gym that you could use to do some core strengthening exercises as well. So I hope that this video finds you well, and once again, send me a DM or visit www.llhealing.com to make an appointment with me.